So this question, is the vaccine even possible, as there are different strains of the virus seen in different countries and different strain in the same country even? So is that even possible that a vaccine would actually exist against the virus with these different strains and different mutations?
I think this also comes from a bit of the misunderstanding of the virology of COVID-19. So the way we define strains in virology is it means that there are sufficient mutations that arise in the new virus, but it changes its phenotype. So a new strain of virus means that phenotypically it's going to be different from the virus it derived from. With SARS-CoV-2, which is a virus that caused COVID-19, we haven't seen yet the emergence of a new strain. People have measured like a mutation between different isolates of viruses. For example, viruses that would be isolated in China or in Europe are a little bit different because they have like a few mutations, but there is no indication that this mutation change at all the biology and the phenotype of the virus. So we cannot talk about strain. It's really different isolate that we can track because they have a little bit of a footprint in their genomes that can give us information about their evolutionary trajectory. But so far, coronaviruses in general are very stable. Like it has really nothing compared to like HIV or flu. They are like very stable, and most of the different isolates, so viruses that have been identified everywhere in the world, they are relatively similar to each other, and so we don't know so far that they will have like a different biology. Now, the good news about that is that since it doesn't mutate a lot, it's likely, I mean, we can definitely not know that without testing, but it's likely that a vaccine that will be generated from the sequence of a given isolate would protect against the different viruses that are in the world today, because they are not different enough. So we can expect, I mean, we can hope, we will still have to prove, but we can hope that one vaccine will be able to protect against the different isolates that circulate in the world. And there are a few preclinical data, notably one of the first vaccines that have been developed in the macaque rhesus model have shown that actually if you use first isolate from a patient to vaccinate the macaque, and you come after with a live virus from another patient, the protection is there. But it has been tested on a few isolates. It still needs to be demonstrated that it will work on any isolate that have been identified so far.
So we shouldn't really listen to the rumors that there are different strains and mutations and it's not stable. So Dr. Vabre explained that this is stable and give a hope for even a vaccine that would actually work against several viruses. So thank you very much, Dr. Vabre, for this clarification.